Good morning. Welcome back to the OHSU Effect Inside Health and Science. Did you know there are ways you can help doctors find ways to fight disease and improve our health? Well, they're called clinical trials, and quite a few of them are going on right now at OHSU. With us now to talk about trials and how you can participate is Dr. Eric Orwoll, Professor of Medicine and the Assistant Vice President of Research. Good morning.
Good morning.
Okay, a lot of people aren't familiar with the clinical trial process. So can you explain what it is and what it's used for?
Yeah, so clinical trials by definition are research that involve humans. So that's as opposed to research that might be done only in the laboratory or using animals. Clinical trials are really all about humans and understanding how humans work, how disease happens, what therapies or diagnostics for disease might be developed.
So how does it work? How's the process like?
Well, real generally, a scientist or investigator has an idea for something important that they want to do, studies designed, support obtained for the studies, and recruitment of the appropriate people for the clinical trial then happens. So volunteers are recruited, studies done, results are interpreted, and whatever happens after that.
Yeah, you make it sound easy, but of course, what a volunteer would go through would depend on what the trial is about, right?
No, you bet. So there are some trials that involve normal people. So that's how does the brain work or how does the stomach work, things like that. Some trials involve people with illnesses, and then it's all about how the illness works. And then some trials are about giving drugs to treat illness. So it depends on what the trial is about.
Yeah, so really anybody can take part in a clinical trial, right?
You bet.
So what steps are taken, though, to ensure a person's safety during a clinical trial?
This is a very well-developed process. So there was a time when safety was not paid much attention to, but now there's a very carefully scripted process that involves how the study is designed and exactly how the consent is obtained for the patient, what the patient needs to know. And so what a potential volunteer would see is that the study must be described to them in detail, and they need to know exactly what's going to happen to them, who's responsible for the study, and they give what's called an informed consent. And in the background, that study has been evaluated by a board of uninvolved people who evaluate the risks and benefits and decide that the trial is actually acceptable to be done. And then during the trial, there's also a very carefully scripted process that involves overseeing the trial and what's going on in the trial, and are there any adverse events that are happening that are unforeseen. And basically the safety of the trial is very carefully done.
Any other questions that a patient should ask, like if they're taking drugs, if they're testing a new drug, any other concerns there?
Oh, yeah, the patient should understand exactly what's going on in the trial and what the potential adverse effects might be of anything that's going on, whether it's part of the testing or whether it's a drug. The patient should be told and should be given the opportunity to ask any questions about what might happen.
Can a person drop out of a study or a trial at any time if they're feeling uncomfortable?
It's completely voluntary at any time. So getting into the trial is completely voluntary, and then staying in the trial is completely voluntary. So there should be no pressure to either be involved or continue to be involved.
Well, tell us why you think people should take part in clinical trials.
There's a variety of reasons that people might be interested. One of the common ones actually is just to help with medical science, the development of medical science. And people are motivated a lot to do something that's going to help other people. Sometimes it's because they have a illness that they would like to see progress made on. Sometimes they have an illness and the trial might help them. The issue of money frequently comes up, and one of the criteria that's used to evaluate a clinical trial is whether money is being offered to the subject that might influence their motivation for being involved, and that's simply not allowed. So you can't do a trial that pays the participant enough money that might be considered to be inducive for them. So why to be involved? A lot of reasons, but usually they just want to help or they think it might benefit them.
Well, there are quite a few clinical trials going on at OHSU. Tell us about those.
Well, there are right now about 500 active clinical trials at OHSU alone, and there are a lot of trials outside of OHSU in the region, of course. And those trials are very different in their character. Some of the ones that I do, for instance, involve recruiting older men. I'm very interested in musculoskeletal health in older men. So these men volunteer to have a lot of testing done, and then we simply follow them over a long period of time to see what happens to their musculoskeletal health. We don't give them any drugs, and that's called an observational clinical trial. It helps us learn a lot about how things develop. Another clinical trial that's going on at OHSU now involves treating macular degeneration, which is a common form of blindness in older people, with stem cells that are injected into the back of the eye to see if we can regenerate what's going on in the eye. And geez, the number of trials is large, and the variety of things that are being investigated is also very large.
Yeah, it sounds like it. And the study that you're involved in with the musculoskeletal system, that sounds like people might have to be signed up for the long haul, right, if you're following them?
It's very impressive. We recruited 1,000 men in the Portland area, and it was not hard to do that. The men were very interested in participating, and 99% of that have stuck with it now over the course of about 10 years.
Oh, wow. That's great. Well, is it more difficult to find other participants in different fields?
Oh, yeah. So depends on the trial, of course, but one of the typically difficult kinds of trials to find folks to be in are with rare diseases. So if you have very few people with the disease in the area, of course, it's going to be hard to recruit. And then you might have to involve lots of medical centers across the country or the world. Another kind of disorder or a clinical trial that's very hard to recruit for are those that involve people that are very ill at that moment. So the last thing they're thinking about, of course, is being in a clinical trial. And so very difficult to recruit for trials like that.
Any other types of research where it's easier to find participants?
Yeah, I think the trials that are easy to recruit for are those where the disorder is in the news at the moment. So when the whole populace is very interested in a disorder because they've heard about it a lot in the news and they feel that it's common and it might affect them or their family members, then they're much more motivated to be a participant.
I would imagine that there are a lot of clinical trials involving diets and the foods people eat, especially the observation trials like you mentioned. Is it easy to get people to kind of stick with a regimented meal plan?
Terribly hard. Yeah, a diet study, a lot of dropouts, and a lot of people just can't keep up with it. Another example like that is exercise studies. So really hard to keep people exercising the way they should to observe what's going to happen. But that's kind of predictable. They're very interesting trials, and everybody's fascinated by these problems, but to stick with it over that period of time, really hard trials to do.
Yeah, and how do you make sure that they're being honest and reporting how much exercise they're doing?
Yeah, big problem. So to do a good trial like that, in fact, any good trial, you have to build in ways not to just ask somebody what's going on, but to really observe what's going on. So an exercise study, for instance, good exercise study usually involves not going home and exercising and asking how much you've done, but actually exercising in person. So you observe the exercise that's going on. Obviously, that means the trial's complicated and probably expensive.
Oh, maybe they should just video it and put it on YouTube and make you do that.
There are some really interesting ways that are being developed now to do this automatically. So to wire up some sort of sensor that records how much exercise is being done. So the equivalent of observing somebody, but doing it in the background.
Sure, sure. Well, Dr. Eric Orwoll is talking with us about clinical trials, and we have a few more things to discuss, especially about medication testing and maybe some misunderstandings about clinical trials. So can you stay with us?
Sure.
Great. More of the OHSU Effect, Inside Health and Science, coming up in 5 minutes.